Good morning, Dr. Tan See Leng, Minister for Manpower and Second Minister for Trade and Industry of Singapore, distinguished guests, speakers, panelists, and everyone else who's joining us here online and here in person today. Warm welcome to today's Temasek Shophouse Conversations. First, if you're sharp enough, you will know that I'm not a youth. So this is the second time I'm using a device to give an address. And I may trip up here. There's a standby written speech somewhere for me if I do. But I decided to do this because I saw Jennifer going for the iPad as well, and we are of the same vintage, so I said I better compete with her. Last year, our conversations focused on pandemics, climate action, and also on building a healthier future for our families. Today, we are focusing on how we can enhance the mental resilience of youth in our communities. Let me at the outset thank the KK Women's and Children's Hospital of Singapore and Campus Sci also of Singapore for partnering us in this event. Many of you already know that Temasek Foundation, we have three strategic trusts that guides our programs. One, strengthening social resilience and uplifting lives. Second one, fostering international exchange and enhancing regional capabilities. And third, advancing science for a sustainable world. Under the first trust, a priority for us is to support programs that uplift lives of the vulnerable and those that nurture our young people. To complement this, we also work with partners to run dialogue platforms such as today's platform. I believe, and we believe, these all help us to enhance mutual understanding of the key issues and prompt us to work collaboratively on innovative programs based on shared perspectives. Now, you may know, even before the pandemic, youth mental health was already an area of growing concern in our communities. Here in Singapore, definitely, and I'm sure elsewhere in all your communities where you are joining us from. The pandemic and our various community responses, for example, online learning, circuit breaker or lockdowns, safe distancing, other measures, I think all of us will agree that these have clearly added to the complexity of the mental health issues faced by our young people and perhaps also by the larger community where we are. To address this concern, the Temasek Foundation has supported the provision of online conversations and messaging platforms for counseling and care, such as the hashtag ChatSafe program, I hope I said it right, in partnership with the Samaritans of Singapore, and Chatline, capital Chat Line, program with the Institute of Mental Health. We are also collaborating with MediaCorp. Some of you already picked it up. We've watched it as well on our TV, on television, to run a broadcast program series to help parents, caregivers, and peers of youths who face mental health challenges. Besides these online counseling and care programs or platforms, we also collaborated with Lions Befrienders of Singapore to use facial emotion analysis, artificial intelligence technology to assist counselors in mental health screening and care planning for seniors. I'm sure you can see the potential to apply this technology to support our young people. As interested parties like all of us here continue to dialogue and collaborate, we can work out many more innovative solutions to address the issues that we face collectively. We are heartened to see many others like us taking the initiative to support platforms such as today's platform. But perhaps I can suggest that our conversations can dialogue around three broad clusters of issues. Number one, emerging issues, the digital economy, the future of work, up your alley, Minister, response to future pandemics, and might I suggest a possible deterioration in social cohesion given our volatile uncertain, complex, and ambiguous world. So, emerging issues. The second cluster of issues we could dialogue on would be enduring issues. Issues that continue to plague us year in and year out despite our best ongoing efforts. I'm sure many of you online dialing in from where you are, you will agree with me that issues such as dengue continue to plague us in Southeast Asia and perhaps in the larger Asia community. Issues such as diabetes in middle-income countries or even in the other countries that are coming up nicely. These are issues that will continue to plague us, and perhaps we can continue to dialogue. Enduring issues. And the third group, obviously, existential issues. Issues such as climate change, livability, and so on. So we hope that today's dialogue will lead to greater understanding and collaborative action in the important area of human mental health. So many professionals here, I know I'm in safe hands. If I have a certain issue of mental health, I know I can see one of the doctors and professors in the audience today. So I'm glad that you all are here today to help us dialogue and perhaps unearth new ideas, new perspectives, and new solutions. By continuing the conversations beyond today and by sharing our learnings and experiences, research and expertise, we can all play a part in enhancing the resilience of our future generation. So I have kept my comments brief in anticipation of learning from Minister and from the rest of you today. And I look forward to learning with you and from you. Thank you once again for joining us this morning.